But when it comes to finding the right health care, approach it like if you were buying a car. Research, compare, demand answers, and know you have choices.
And that's advice from a local specialist who says patients must be their own advocate. Channel 3's Catherine Daniel finds a woman who did just what the doctor ordered in tonight's Healthwatch report.
No.
In this story, the happy ending comes first. Katie Zimpher is healthier than ever. In November, she was diagnosed with a stage 1 cancerous lung tumor. By mid-January, Katie was recovering from a successful Vinci Robotic surgery. The 69-year-old social worker is already back to work.
In my opinion, I'm doing exceptionally well.
Her specialist, Thoracic Oncology surgeon Paul Chomiak, agrees. He says how and why Katie got better so quickly was all her doing.
When we met for the first time, she knew my entire biography. She knew where I went to school, where I came from. It was quite amazing. She had done as much homework about me as I did about her medical condition.
Katie says she went looking for Chomiak because another doctor out of town only offered her a conventional surgery.
A large incision, cutting muscles, spreading the ribs, and that translates to months of aches and pains and dysmobility of the shoulder and prolonged hospitalization.
At my age, it would have probably been the end of my career.
Katie gathered her info.
And she reached out to me. So she actually got all her films and all her medical records.
Katie demanded answers.
Always ask questions. I enjoy being challenged with questions.
Katie says for more than an hour, patient and potential doctor connected.
I felt like I was the only patient he ever had. That was just the kind of feeling, and that he drew me pictures.
Sounds simple, but Chomiak always sketches out the problem and possible procedure. By the end of the meeting, they were a team and had a plan.
In fact, I left here on the 6th with the scheduled date for my surgery.
Chomiak says if you're not that sure right off, don't rush. He always encourages getting a second or even third opinion. And when it comes to surgery, ask if there's an alternative.
Of all the patients that could benefit from minimal invasive thoracic surgery, only 10% of patients are actually offered that opportunity.
Post-surgery, Katie kept up her aggressive attitude.
Got up and walked, and I walked in the afternoon. I rode a little stationary bicycle.
Dr. Chomiak says Katie's approach is a blueprint for all patients.
And I'm up and breathing and enjoying life in less than a month. I mean, that seems impossible.
Catherine Daniel, Channel 3 News.
For more health news, just head over to WEARTV.com and click on the Health tab.